Hi, friends. Most people are eating way too much protein and not nearly enough fiber, and it's wreaking havoc on their gut health and metabolism. Dr. Angie Sadeghi is a board-certified gastroenterologist who's going to explain why and what you can do about it. Speaking of fiber, would you like to add more plant-based meals to your life that are packed with fiber and nutrients? Download my free cookbook at wellelephant.com after the show. I've adapted some of your favorite foods like queso, spring rolls, and cupcakes to make them whole food, plant-based, oil-free, and low-fat. And if you're really ready to take control of your health and heal your body the way I did, check out my online class, Ace Plant-Based Eating, while you're there. You'll get all of the strategies that I used to reverse my heart disease and lose 20 pounds. And of course, I want to thank you for listening. It really does mean the world to me. I'm not just blowing smoke. You've helped Age Like a Badass Mother move into the top 5% of all podcasts in the world. I appreciate each and every one of you. So thank you. And now here's Dr. Sadeghi. Hi, friend. Are you looking to age healthfully, confidently, and vibrantly? Then this podcast is for you. Smart, slightly salty, irreverent, and thought-provoking. I'm Lauren Bernick, and this is Age Like a Badass Mother. Dr. Angie Sadeghi, MD, is a board-certified gastroenterologist and internist in Newport Beach, California, specializing in evidence-based, personalized medicine for digestive health, disease prevention, and age management. With advanced training from the University of Southern California, Dr. Sadeghi integrates her expertise in gastroenterology with plant-based nutrition, fitness, and bioidentical hormone therapy to help patients manage and reverse chronic diseases, including obesity, metabolic syndrome, and liver disease. Please welcome Dr. Angie Sadeghi. I'm so glad to have you.
Thank you so much for having me, Lauren. I'm so excited to talk to you.
I'm excited to talk to you. I guess let's just start. It seems like you've had your own health journey. Is that kind of what led you to eat plant-based, or can you share a little bit about that?
Yes, I definitely have had my own health journey, but my veganism was for the animals. I'm an ethical vegan, and I actually went vegan for the animals. But what I experienced is amazing health as a result of starting to eat plant-based. In May of 2014, I started eating a whole food plant-based diet, and I started experiencing immense energy, great health. My cholesterol went down. Like I said, my energy was boosted to unlimited levels where I could just do things that I could never imagine doing. My fitness level went higher, and I was able to lift heavier weights. My body trimmed, and I started looking better in the mirror, and I was able to shrink my waistline.
I saw that on your Instagram.
Yeah, thank you. I was even able to compete in a fitness program. My eczema got better. My skin cleared. I mean, I can go on and on. I did it for the animals, but look what happened.
Yeah, that's something. It's very interesting. Which brings me to why is it bad for us to eat meat and dairy? What does it do to our bodies?
Well, I mean, you don't even have to be extreme where you avoid meat 100%, but the more plants you eat, the more colors of the rainbow, the more fiber-rich foods you eat, the healthier your body will become. Most of the studies out there show that a Mediterranean-style diet, which is plentiful in fruits, vegetables, nuts, seeds, grains, and legumes, which are fiber-rich foods that are low in saturated fat, can improve your health. And there are many reasons that can happen. So I just want to emphasize that if you're not ready to be 100% vegan, that's okay. Even if you eat a more plant predominant diet and you try to limit the meat and dairy, that's actually great. So, but yeah, these fiber rich foods, starting from the GI tract, can cause health by improving the gut microbiome health. So from mouth to anus, we have hundreds of trillions of gut microbiome that line our guts. And these microbiota that consist of bacteria, viruses, protozoa, fungi, and et cetera, these guys like and enjoy eating fiber-rich foods. And as a result of metabolizing these fiber-rich foods, produce something called short-chain fatty acids. And these short-chain fatty acids are important for not only gut health, but also health in the rest of the body. So, for example, a lot of people don't realize that if you want to grow your muscles, you need fiber to do that. And these short-chain fatty acids increase the number of mitochondria in your muscles to give you more boost, more strength, right? And also, one of the things they can do is reverse DNA mutations in the gut to prevent colon cancer, for example.
Oh,
yeah. So
that's very interesting and exciting news.
Exactly.
Yeah.
So yeah, it's like it's from so these fiber-rich foods are very, very important for our health, yet there's such a huge emphasis on eating a lot of protein and not enough emphasis on eating fiber. So, I always say to my patients, don't be a proteinaholic. Focus on your fiber intake, and the protein will it'll be okay. It'll be fine. You're not going to starve of protein deficiency. It's almost impossible in this country to starve and have protein deficiency if you're eating a variety of plant foods which have a ton of protein in it already.
Yeah, I'm glad that you said a couple of things. One, that if this is not where you are today, it's okay. And I always say that. I just, I want to meet people where they are, and I want them to listen, and I want them to keep listening until they're ready, to all of us, to all the voices out there who tell you to just keep at it. Just keep eating your plants and your fiber, your fruits and vegetables, legumes and whole grains, and cut back on the meat, cut back on the dairy, because you're right. The Mediterranean diet, I guess they say like the meat is like the garnish, like it's a small, tiny piece, but they have it once in a while. So I think that that's really important. And the other thing I want to touch on is, you talked a lot about eating fiber. I have heard a lot. I guess these are not people who are all up on the maybe the new research like you, but I have known people with IBS, IBD. They have a hard time with insoluble fiber, and their doctors place them on a low FODMAP diet. But you have like a hard stance against that, right?
Yes. So a low fiber diet is definitely not a healthy choice for the gut. So if you're in an acute flare-up of your inflammatory bowel disease, like for example, if you have Crohn's disease or ulcerative colitis, and you're in an acute flare-up, it's important that while you're in the hospital, you actually follow that advice, because when you're in an acute flare, you don't have the gut microbiome balance to break down fiber, and it's important to do a low residue diet. It's called a low residue diet, and you basically limit certain things. And a lot of times we put these patients on a clear liquid diet, or we put them on a low residue diet. For example, a patient...
But it's low fiber, right?
It's low fiber. Low FODMAP is also low fiber, pretty much. Right. And low residue diet is also low fiber. But that's only in an acute flare. Like, for example, if someone has Crohn's disease and they have a stricture, meaning the bowel is closed up, and nothing can get through, what you would do is a low residue diet, because you don't want to make a lot of stool. So it's not that it's the healthier choice to put people on a low residue diet. It's definitely the unhealthier choice. However, when someone has a blockage in the bowels, you don't want them to make a lot of stool. And a low fiber, low residue diet helps decrease the stool production, because fiber bulks the stool. Does that make sense?
Yes. But once they're out of that like critical situation and they're back home and they're, kind of, how do you know when you're back on track and ready for fiber?
Yeah, so what we do a lot of times in patients who have these acute flare-ups of their IBD in the hospital, we load them up with medications to put the fire out. We basically try to eliminate the inflammation. Once the inflammation is eliminated and their disease is under control, then they can start reintroducing fiber, and they should, even if they get bloated, because the most important thing is to get that microbiome balance back in their gut. And when they have acute inflammation, the microbiome balance is gone, it's diminished, and it's very that inflammation just erodes the first lining, the mucosal layer of the gut, and there goes the microbiome with it, right? So we need to get it back. We need to bring it back, and in order to do that, you need to eat fiber.
Okay. And what do you say to people who are like, because I know a lot of people like this, I can't eat beans, it just bloats me, I can't eat a lot of fiber, it just bloats me so much. What do you say to that? Or how do they build up?
I hear that a lot, but when I see patients in clinic for bloating in particular, and I do a deep dive in why they're having bloating, it's usually not the beans. It's something else. And so people like to, when something becomes popular, they focus on it. And when you focus on it, then you have that problem. When you keep focusing on beans cause gas, it's not that the beans cause gas. People have an imbalance in their gut, and that's how they get gas and bloating. Foods aren't gassy, people are gassy. And the thing is that if you're having excessive gas when you eat certain things, that means your gut is not processing it well, and your body is not. If you have excess gas, something's wrong, right? And a lot of times people come in to see me and they say that it's the beans and it's this and it's that, and I actually find that it's not the beans, it's something else, and it's just food in general causes gas, because something's going on with the digestive system. And there are hundreds of reasons why people could have it, but it's very individualized, right? So that's where someone like me, a gastroenterologist, could help dive in and figure out why it is that they have that problem.
Is there, like, I have a friend, she literally can't eat. Like, when we go out to dinner, she has to wear a loose dress. She's a tiny girl, but when she eats, immediately her stomach blows up and she looks like she's pregnant. And this has been going on for years. She's tried everything. She really has this severe bloating problem. Have you seen this, or
I see this kind of a thing every single day. That's what I do for a living, is gastrointestinal health. And so bloating is one of the most common reasons why patients come to see me. And I have to take a deep dive into their health, blood tests, physical exam, and questions, and all of that put together. I can usually diagnose it. But it's different for everyone. And it's very hard to say, for example, your girlfriend may have acid indigestion, because I don't know. Based on the limited information I'm getting.
Right, obviously.
To know. But I usually, when I meet people with gastrointestinal problems, I ask them a lot of questions. I do a detailed history. I do a physical exam. I do blood tests. And then we go ahead and pursue treatment options. But if I see 10 people with bloating, there could be up to 10 different reasons why those people are bloated. It's not cookie cutter.
That makes sense, but it's just like, so it just blows my mind that how many people have problems. I'm sure like you see it all day long, but it's like, what is going on? I feel like there's just so many new things that we see all the time now that we didn't used to see. Am I wrong? Or
America is sicker for sure. We're more obese and we're sicker than ever, of course. And I think that it's because of our lifestyle choices. A lot of alcohol, a lot of drugs, very little physical activity, and a lot of meat and dairy. Put it all together, we have a sick nation. Oh, definitely. I heard this alarming statistics the other day that 75% of Americans are obese or overweight now.
Oh gosh.
It's alarming. And obesity is one of the biggest root causes of all other diseases, pancreatic cancer, uh, colon cancer, heart disease, strokes, and all of those other things. So, it's a problem in our society that we have so much obesity, so much illness. People have a lot of inflammation. For sure, that it is a problem. And I'm so glad people like you are doing podcasts to get the word out, And guess what? It's like the entire world is focused on eating more protein, and look where has it taken us?
Yeah, I think that is one thing, between the processed food, between you have to get enough protein, between, the sedentary lifestyle, all these things I think you're right, are contributing. And what hurts me is that it is really not easily fixed, because it's not easy to change your diet and your lifestyle, but it can be fixed. And what I like about you is that you're very evidence-based. You're one of these doctors who's, like you said this to me before, there's a whole lot of talk out there that food is medicine. And I have a lot of that in me. I'm not going to lie. I want to try and fix things with food before I go to medicine. But you're like, food is food and medicine is medicine. So what do you want to say about that?
Yeah, I used to make that mistake of thinking food is medicine, but no, food is not medicine. Food is nutrients, right? Like when you think of food, what do you think about? Broccoli and, rice and meat and dairy and whatever it is that you're consuming, that's food to give your body calories, right? Medications are usually basically pharmaceuticals. These are chemicals that could be natural, right? They could be either chemicals synthesized in the laboratory or concentrated forms of plants, whatever it is, in a pill form at higher doses to target disease. When you have a disease, like for example, here's an example of how food is should be used as nutrition, right? To prevent disease. If you eat a high fiber diet, right, that prevents colon cancer. Not 100%, but if you're eating a high fiber diet, that's a preventative and it can prevent colon cancer. But once you have colon cancer, you don't want to eat a high fiber diet and put your head in the sand and use that food as medicine. Then you need medications, then you need chemotherapy. Otherwise you die of colon cancer. So you cannot say that food is medicine, because food is not medicine. Medicine is used to combat disease, to reverse disease, to kill cancer cells, to reverse heart disease, all of those things. It is not to be used as, food is pretty much to prevent disease. Does that make sense? I'm probably not articulating it the best way.
I think, especially what you said about cancer makes sense. Like, you can really hedge your bets by eating well.
Yeah.
But, we're all people and we sometimes still get disease. Yeah. And then you might need medicine. I definitely try to do things with food, with lifestyle before I do medicine. I've been doing a lot to lower my cholesterol. I have that very stubborn high familial cholesterol and the high LP I have all that stuff. But recently I've been doing more to lower my LDL, and it's been working, like more things like sumac and amla and, just adding a lot of things to my diet and trying to get it down that way. Will I ever take a medicine? Maybe, if I really feel like I'm in trouble, I would certainly go that route. Yes. I mean, I don't want to die, but I certainly want to try to do it the most natural way possible first. And I think maybe that's where people are coming from. But I understand what you're saying, because there are some doctors out there that are saying, like, what, don't get a colonoscopy, don't get a mammogram, like right. That you don't need to do that. And that's silly.
It's so crazy. I mean, you're gonna basically not have you. First of all, to not go with the general recommendations just because you're eating healthy is very silly, because you still have genetic predispositions. You have to marry both, obviously, plant-based eating, eco-rate lifestyle, don't smoke, don't drink, don't use drugs, eat a lot of fiber. But even when you do that, it's still not enough sometimes. Sometimes you need to follow evidence-based medicine, because a lot of us have genetic diseases that we cannot combat naturally with just eating a healthy diet. You brought up the cholesterol issue. Well, I personally have that gene, the LP little a, which it puts you at a high risk for cardiovascular disease. And I cannot possibly get my LDL lower than 60 naturally. There's no way. I've tried. And so that's why I chose to go on a statin, because I want to be a vegan. I don't want to be a stupid vegan and die of cardiovascular disease. Does that make sense? So I don't care how high fiber you eat. I don't care how plant-based you eat. You're not going to naturally bring down your LDL to a point where it's protective. We don't have a cure for this LP little a, elevated LP little a. And so a lot of people are dying of cardiovascular disease because of it. And your diet has, I'm sorry, it's very limited control of it. And so you could start in your 50s, like I'm 52, right? And I started on statin therapy at age 50 because I couldn't control it with diet anymore. And so now I'm hoping that I can prevent the disease. Once your brain arteries are clogged off, like, good luck, you're going to have dementia, because you're pretty much cutting off the oxygen supply to your brain. And these brain arteries are tiny. I'll have a heart attack over a stroke any day. I will have a heart attack over dementia any day. And a lot of people think, well, I'm going to go on stand to prevent a heart attack. Well, a heart attack doesn't even bother me, because they have so much technology where they can put a stent in there. They can open up your chest and put new arteries. Like, they can take out veins from your legs and put it on your heart. You'll live. I see people live all the time after a heart attack. It's the dementia that I want to prevent. When these vessels clog up, especially the vessels that feed the brain tissue, are smaller than the coronaries in your heart. You know, the coronaries are actually rather large arteries. The ones that feed your brain are tiny. They're like thin, like a hair. And so when those things get clogged up, you start developing dementia. And so a smart person, takes those medications and prevents it. A highly intelligent person prevents it. Smart person treats it. When they get to that point, they go to the doctor and say, oh, I can have some medications to reverse my dementia. And they go, sure, but these medications don't do a lot. Good luck. Or a very intelligent person prevents that. So you got to kind of look at your life as, okay, I'm 50. I want to be 100, but I don't just want to live. I want to thrive. Okay, so how do I prevent these diseases that I will develop at age 80? Like stroke, heart attack, osteoporosis, dementia, all of those things. Does that make sense? So,
it does. It does. And I'm still, I still haven't done the statin yet. And you and I have talked before, and I really never entertained the idea until I talked to you. And I thought, I'm thinking about it. I'll be honest. You've turned my head a little to think about it. Is there like, I've had my carotid arteries tested. There's no plaques in those, but you said those are the big arteries. Is there a way to test your little arteries to see if those are getting clogged?
Not that I know of. I mean, the way it's like, it's very, even the coronaries, there are things like the calcium score that you can check to see if you how much calcification you have in your arteries, which is end-stage coronary disease. They can do some studies to see if there's soft plaque in there, as opposed to the hard plaque that you pick up with coronary calcium score. But there are not that many. Even those tests are not perfect. But we know that LDL is an independent risk factor for cardiovascular disease, right? So for me, I chose to just bring it down and like, and not worry about it, because I know that I have nothing to lose. I take a little statin every day, which it's so funny. Like everyone's so scared of the statins now. I don't get it. I don't understand. It's like, what's so scary about these statins? People are so afraid of these statins, and like, oh, the pharmaceutical industry is making so much money off of them. That's not even true. Statins cost like $5. No one's making money off of it. You get a bunch of these like alternative medicine people online scaring you, making you feel like, there's some ulterior motive. And it's not true. Like literally, if you're not taking your statins, even though your doctor told you so, it's purely stupid,
Okay, I guess I'm stupid.
You're
okay, point
signing up for cardiovascular disease.
But what about a lot of people do have bad reactions, right? Like
no, not really.
Not a lot of people do.
Are you talking about statins in general?
Statins like muscle wasting or muscle pains?
No, there's no such thing as muscle wasting on statins. There's so much
muscle pain and weakness.
They've done studies, and it's like, it seems like the placebo group did the same thing as the statin group when it comes to musculoskeletal pain. Okay. I don't know. I have not seen it in a single patient of mine. Most of my patients have done really well on statins. I've done very well on statins. The studies don't show that there's a huge problem with it. But I'm not saying there are zero side effects. Everything has a side effect. Driving a car has a side effect. Having kids has a side effect. So that one has a really huge side effect.
That's right.
I'm just kidding. I love my son.
No, it does. But, no, you're not wrong.
Everything has a side effect. And it's like, if getting on a plane has a side effect, but we choose to do that even because we don't want to walk from here to Chicago, California to Chicago. We want to ride a plane because it's like, that's the smart thing to do. But the plane could go down and crash. Of course, everything has but the point is with these medications, when your doctor recommends a medication, they've already calculated the risk and benefits, and they wouldn't even give it to you if they thought that the risk outweighed the benefits. Usually, as a physician, as an MD, we are trained to not use medications until absolutely necessary. And when absolutely necessary, we wouldn't even give it to you if the risks outweigh the benefits, because our number one goal is to help you and protect you and cause no harm. So by the time a doctor says to you, you need this medicine, it's because they've already calculated all the risks and benefits in their brain, and they think that the best course of treatment would be to take the medication, if that makes any sense.
I mean, it does make sense. And I think that you are just such a thorough and thoughtful doctor. Not everybody is as thorough and as thoughtful as you. And I think that there are a number of doctors out there that are like, okay, you're over 50, your cholesterol's high, whatever. You're going on a statin. There's no wiggle room, or maybe that's just it. Maybe if you are over 50 and you have elevated cholesterol, that's it. That's standard operating procedure. Is that
well?
Is that right?
I have bad news for people who are listening who are over 50. That's when problems start. And so age is a huge risk factor for disease. And right, yeah, age is an independent risk factor. So if I'm seeing a patient who's over 50 and has high cholesterol, we're going to have that talk. They may say no, I'm not going to do it. I'm like, great. At least I don't feel bad. If something bad happens to them, I don't feel bad that I didn't say anything. I will tell them. I don't force anyone to do anything. Obviously, it's just recommendations, right? We are, at the end of the day, you cannot treat everyone in a cookie cutter way, because everyone's different. People have, when I'm looking at a chart, I'm looking at the history of smoking. I'm looking at their weight. I'm looking at their blood pressure. I'm looking at their cholesterol. I'm looking at their mom's history, brother's history, LP little a, labs. I'm looking at 1,000 things. But so when you come to see a doctor, all of that gets computed within seconds, because we've done this for 20, 30 years, right? I've done this for 20 years. So what seems to somebody who's coming, let's just say, Lauren, you come to see me, I walk in and within seconds I say you need a statin. It's because all of that information gets computed. Literally, I need 10 seconds before I walk into the room to realize you need a statin or you don't need a statin. You need a colonoscopy or you don't need a colonoscopy. So to somebody who's a layperson who's not medically oriented, who is coming to see me, they're like, whoa, she's pushing this so hard. I'm like, she comes in and 10 seconds later, she's telling me I need to do this. So what I've learned to do is the finesse of medicine. This is where I sit down and I talk to my patients. I literally know what I would have done at the very first 10 seconds of the meeting. I already knew what to do. I sit there and I talk to people for 15, 20, 30 minutes. And at the end, I bring it up. And literally, it could have been the same result in the first 5 seconds, but I have to play the game. Does that make sense? Because
100%.
It comes across so insincere, but it's a formula. Like literally, like you put in your age in the formula, and you put in your family history, you put in your blood pressure, you put in your weight. Like 2 seconds later, you need a statin. But you just have to. It's the delivery that's important, and a lot of patients are thinking that it's insincere because we don't have a lot of time to talk to patients anymore. Literally, like look at what's happening with United Healthcare. You guys have heard, I'm sure everyone's heard what's happening with United Healthcare. Like they literally deny everything, and they literally,
I have United Healthcare.
Well, I mean, it's like all insurances are terrible. Everything's like all insurances are bad,
it's all terrible.
Probably the worst ever because I'm constantly fighting with them to get things cleared. There's a famous Dr. Potter who's always online talking about this, that she can't get breast cancer surgeries approved for her patients. I mean, it's awful what's happening. But what I'm saying is we're given the cost of practice has gone up tremendously because of inflation, yet the reimbursements have gone down. So we don't have time to talk to our patients. So a lot of times when we come into a room, spit something out too quickly, it comes out extremely insincere. And I can tell you that all of us doctors, we mean well. We don't want to come across that way, but sometimes we have to move fast, and this is why I have a concierge practice, and I have this option of going in concierge where I charge a fee where I don't have to solely rely on insurance to pay my bills and to put food on my employees' tables. Like I have 12 people on my payroll. Like I got to make sure that I make enough money, and if I had to rely on insurance, I would come across like a jerk. Come in for 5 minutes, you need to stand and walk out. I can't do that, So that's why I'm spending like 15, 30 minutes, 45 minutes with my patients. But I also have a group of patients who choose to pay a concierge fee, so I can do that. Does that make sense?
Yes. And you're absolutely right. I'm like fighting with United right now. You should see how much they're trying to charge me for my colonoscopy. I'm like, I thought this was preventative, and I mean, it's outrageous. Thousands of dollars. It's outrageous.
I mean, insurance is horrible. They're evil.
It's horrible.
They don't care about you. They don't care about your health. And a lot of patients are like, well, shouldn't they care? Because if I'm keeping myself healthy, then it prevents disease. No, they still don't care, because statistics show that people hop on and change jobs, and they change insurances all the time. So if they delay your care, they save money, and then when your health crisis happens, that can be somebody else's problem. That can be the future insurance's problem. So they really have zero incentive to keep you healthy.
Mm-hmm. You're right. Okay. All right. I'm gonna think about the statin. You like I said, nobody's ever really made me think about it before. So good for you. I'm thinking about it. But we talked about obesity, and that it's just such a cause of inflammation and disease, and now we have all these GLP-1s. What do you think of those? And also, I'm seeing this trend of microdosing those. Do you think that's good, or what do you think about that?
So thank you for bringing up that. So I'm also an obesity practitioner. I've studied obesity, and I've actually dealt with obesity myself. So I'm sorry, I wasn't obese. I was overweight, but anyways, I've had this problem my whole life, and so I consider myself an awesome weight loss doctor, a bariatric doctor, because I experienced problems. I am definitely not one of those naturally skinny people. I work on it. I work really hard at it. I eat a whole food plant-based diet. I work out with a trainer, and and I basically want to tell you these GLP-1 medicines. So GLP and GIP. These are natural hormones that are produced by the gut, actually. By the way, when you eat a high fiber diet, it helps produce more of the GLP, GIP. But studies have shown that they also bring down your hemoglobin A1C and they improve diabetes. But also,
that's what they were for originally, right?
That's right. So we've been using this. A lot of people are like, oh, I don't want to go on them because they cause cancer. That's not true. We have 25 years of data that these medications have never been linked to cancer. No one, there was a meta-analysis that these GLP-1 have been, like, in 25 studies, 25 years of studies, hundreds of studies, literally there's no evidence that they cause cancer. But anyway, what they do is they're cardioprotective, they're kidney protective, they protect your liver, they reverse diabetes, they bring down your blood pressure, they bring down your cholesterol, they actually prevent dementia. I mean,
wow.
I literally think that I would say that antibiotics were revolutionary at the time they got introduced because they saved a lot of lives. I think that the GLP-1s are the second biggest discoveries we've had.
Oh, really?
Yes. And I would say, like, for example, statins would be number 3. But, these GLP-1s are awesome medicines. I have had patients lose up to 100 pounds of weight. And
wow.
That, not only that, they're like, I have a patient who lost 100 pounds and he's like on his dirt bikes, like, riding his motorcycle, playing the drums again. He can walk again. He couldn't even walk. So much. And like, this is the power of medications. Now, you can sit there and go, oh, just eat healthy, to somebody who has the genetics to gain weight. I mean, nobody chooses to gain 100 pounds. Like, don't tell me that that's just normal. No, right. It's genetics. And like, a lot of these people are now walking again, and they're telling me, Dr. Sadeghi, that food noise is gone. Like, I'm not constant, like, food doesn't just control my whole life anymore. That's powerful. And so to hold that back from someone and just tell them, oh, just eat a salad, just go eat a salad. No, it just doesn't work. In studies, it's shown that willpower alone doesn't work in weight loss. So anyway, this is why I'm so pro medications. When used appropriately, it can save lives, right? It can save lives. But anyway,
yeah.
GLP-1
what happens
is so healthy for you, and so the microdosing, it hasn't been studied. I wanted to talk to you about that really quick. So when you use these medications at the doses indicated for diabetes and obesity, they work. They work like a charm. But the question is, the microdosing, what does that mean anyway? Right? So for example, when we use Zepbound for weight loss, when we use Mounjaro for diabetes, it's at 2.5 milligrams. Okay. When we use Wegovy for weight loss, it starts at 0.25 milligrams. Ozempic, same thing, at 0.25 milligrams. So some people are coming and talking about microdosing. I mean, that doesn't really, there's no standard definition to it. And I'm assuming they mean the lowest dose possible, just for, health, just for maintenance. If that's the case, I'm all for that.
Okay. I don't know. Yeah, that's a good point. Like, what is the definition of microdosing? That sounds like a microdose, what you just said, 0.25 or 0.2. What'd you just say? 0.25?
Right. So it just depends on what medication. If you're using Wegovy, it would be, or Ozempic, it's 0.25. But if you're using Mounjaro or Zepbound, it's 2.5, and those are the lowest doses possible. So when this microdosing is kind of like a trend that people talk about, like,
right,
it's like kind of cool. It sounds great. Like, basically, I'm assuming they mean not a high dose for someone who doesn't really need to be on a very high dose, just for health reasons and for maintenance reasons. It makes a lot of sense to me, Like for diabetes, a lot of studies show that 5 milligrams of Mounjaro is perfect to keep their hemoglobin A1C in check. And for my patients who use Zepbound to lose weight, what we do is I try not to completely get them off, or I cycle them on and off, because these people have genetics, right, to gain weight again. And so if you take them off completely, sometimes they gain the weight back. So you have to be very careful to bring the dose down slowly, and sometimes just keep them on a small dose. Now, if you want to call that a microdose, fine,
Yeah. So you're saying that some people will really likely have to be on this forever. Is that kind of what I'm hearing, or?
Well, I mean, I think it's all individualized. Like when we look at the studies, it hasn't been properly studied for that, to use it forever. What we know that is that people lose weight. So you go from 2.5 Zepbound, and you dose escalated to 5, then to 7.5, then to 10, then to 12.5, then to 15, whatever. What I'm saying is, there are people who go all the way up and they lose 70, 80 to 100 pounds. And then if you get them off really quick, that could be a recipe for disaster. So you have to be very careful and teach them lifestyle modification. This is when I marry evidence-based medicines and the use of these powerful medications with lifestyle and integrating. I call my Institute of Plant-Based Medicine because we focus heavily on nutrition, not as medicine, but as combination with evidence-based medicine. We bridge the gap between Western medicine and a healthy lifestyle. And so I help my patients eat more and more plant-based, so they can still eat volumes of food, but it's plant-based foods, right? Like I teach my patients, portion control doesn't work. If I give you a block of cheese this big, like a tiny block of cheese, that's like 500 calories. Or you could eat like a huge meal of salad, that's 500 calories. So like portions, the size of the portion doesn't matter. How calorically rich something is matters. So I teach people how to eat. So hopefully I can either get them off of the medicine however way possible, if possible at all. But if they can't, then there's no shame. Some people choose to stay on a small dose to prevent weight gain, and there's nothing wrong with that, honestly.
Okay. I mean, yeah, I wanted to have you on because I respect what you're saying. It is different than a lot of the guests that I have on, and I feel like it's good to explore all the options. I feel like you're, like I said, a very thoughtful, educated person. And, it's just good to hear these different ideas. And, I like how you married the two, the evidence-based.
For bringing this up, because I feel like a lot of us vegans are going too far and actually hurting ourselves. I mean, do you know how many vegans I see with colon cancer and osteoporosis and heart disease? I mean, we're going to start dying off, doing worse, having worse outcomes than people who are into evidence-based medicine. And why should we do that? I mean, that's where I want, as a vegan, as an ethical vegan, believe me, nothing would make me more happy than to sit here and say, like, as long as you're vegan, you're fine. You don't even need to go to the doctor. But the reality is that vegans are dying of diseases as well. And as a vegan, I want to make sure that my fellow vegans are healthier than everybody else. So medications are powerful and sometimes needed. Mammograms are important to prevent breast cancer. Not to prevent, but to detect breast cancer as early as possible. You can't prevent breast cancer by doing mammograms, but you can detect a lesion as early as possible. Colonoscopy can actually prevent colon cancer because you're removing these polyps that are not cancer. So there's a difference. Some screening tests prevent cancer, some screening tests detect cancer early on. And in my opinion, it's stupid not to do that. Like, why? Why not? Why not prevent things or detect things earlier? And of course, we bridge the gap and we marry this whole food plant-based diet and exercise and lifestyle medicine. Really, it's actually lifestyle medicine, because I also talk to my patients about not drinking and not smoking. You could eat vegan all you want, but if you're smoking, you're going to screw something up.
Yeah, it's not good.
No.
Okay. What's your best piece of advice for aging well?
Good question. there's nothing really proven to be purely anti-aging, like to reverse disease. There are some very limited studies that if you eat a high fiber diet, you can increase your telomere size.
That's the little things on the end of your DNA. Is that right? Yeah.
Yeah. So there's something called anti-aging and there's something called age management, right? So you want to stay healthy and youthful and energetic and young as long as possible, right? Isn't that everybody's goal? Like, that's my goal. I want to look young and be healthy. And I want to be able to hike at age 90, right? That's the goal. So, but the older I've gone and the more research I've done, I've realized that there's nothing truly anti-aging to reverse your age. You can't. But what's more appropriate to say is age management, meaning aging well and keeping your biological age younger while your actual chronological age goes up. And there are some very limited studies that show that eating a plant-based diet, you can actually lengthen your telomeres. I don't know. I'm not 100% convinced yet. These are limited studies. I think this story has to develop even more before we can really talk about it with conviction. But age management is key. So my advice, eat a whole food plant-based diet. Don't obsess over your protein. I personally eat only 30 grams of protein per day because certain amino acids are linked to aging, right? Like methionine and leucine. So if you're eating a whole food plant-based diet and you don't obsess over your protein, by the way, let me calculate how much protein I actually need. I'm not an athlete, right? So I have my calculator here. I'm 107 pounds. Divide that by 2.2. I'm 48 kilograms times 0.8. It's 38 grams. This is how much protein I need for health. At literally, actually, that's a generous amount of protein I need. So
how do you calculate that? Can you just tell me again?
What you do is you take your weight in pounds. So I'm 100 pounds divided by 2.2. Divide the weight.
Your weight divided by 2.2.
Yeah, your weight divided by 2.2, it tells you how many kilograms you are.
Kilograms, okay.
Multiply that by 0.8. And so for me, it's 38 grams of protein that I need to eat per day. And that's actually the maximum. The minimum would be even lower. And also, this calculation is very generous. So if you have a high body fat, so what you would do is subtract it. So for example, if you're 300 pounds and if you go 300 divided by 2.2, that's 136 grams times 0.8, that's 109 grams of protein. That's actually too much protein. So what you want to eat, the protein has to be 0.8 grams per kilograms of lean body mass. Okay. So if I wanted to be a purist, what I would do is I would take 107 times 15% body fat. That's 16 pounds of body fat, right? So what I would do is I would go 107 minus 16. That's my lean body mass is 91 pounds divided by 2.2. That's 41 kilograms times 0.8. That's 33 grams. So I need 33 grams to about 40 whatever grams of protein. Any more than that, you're basically not eating enough fiber and you're eating too much protein, which can lead to aging, unless you're eating a whole food plant-based diet, which is a little bit different than eating animal protein because the amino acid profile is different. And the amino acid profile for the gut microbiome, it's very healthy to eat a plant predominant diet because there's less sulfur producing amino acids. So if you want to stay hot and sexy and youthful as you age in your 50s. Like, I want to look like Jane Fonda when I'm 80, that's my goal. So what you would do is don't obsess over your protein, eat a whole food plant-based diet high in fiber. Don't listen to the fitness industry. The fitness industry is dictated by bodybuilders. I don't want to look like a bodybuilder. Do you want to look like a bodybuilder, Lauren? No. We are not going on stage and lifting. Like, we don't want to look shredded like that, like a bodybuilder. We want to look like beautiful, healthy women with muscle mass,
right?
Not skinny, fit, but not bulky either. So all you need, trust me, is that much protein that we calculated. That's all you need. And then, if you do more, if you go out of your way to eat more protein, then you cut down on the fiber and the fruits and the vegetables, and that's not good. So eat a balanced diet. And that to me is my biggest advice as far as age management is concerned. So food, this is where you could really, really get into this whole food as prevention and keeping healthy, right? My other advice is don't drink. There's no safe levels of alcohol. Just drink 1 glass of wine a day. Terrible idea. I mean, sure, go for it, but it's not good for you. Just realize that 1 glass a day is terrible for you. Number 3, do not smoke. I think that's the worst thing you could do to your body. One of the worst things you could do to your body. My 4th advice, so first is diet. Don't smoke, don't drink. I would say exercise, and not just cardio. I'm talking about weight resistance exercises. That's very, very important. And my 5th advice is use hormones, bioidentical hormones for age management to prevent osteoporosis, to sleep well, because sleep is very, very important for our health. And without that estrogen, I don't know about you, I can't sleep well. So I think bioidentical hormones are important for good sleep hygiene, and not just hygiene, for good sleep, and also keeping our bones healthier. And I probably have more, but those are the top 5.
I mean, that sounds like good ones. You brought up hormones, and this is crazy. I'm 57 years old. I'm still like perimenopausal. I'm maybe just now starting to have irregular periods. And do you believe in like birth control for going through perimenopause or menopause, or straight to the bio?
I put my patients on bioidentical hormones during these times of, when they're having these irregular periods and they're having hot flashes and insomnia. Once they become symptomatic and everything, I use bioidentical hormones. They don't have to be fully in menopause. I think it's important to support the whole hot flashes and the menopausal symptoms. Birth control pills, I don't think are a good idea for people our age, because I think a lot of the women, what I did is I got an endometrial ablation at age 50 to stop my periods, because if you're not going to have kids, and the only regret I have is that I didn't do this sooner. Like, I should have gotten an endometrial ablation 10 years ago, because if you're not going to have babies, why have periods? Like, doesn't make sense. So they go and zap the endometrial lining of your uterus, and you don't have periods anymore. So you don't have to have this dysfunctional periods where, and during menopause, as it just becomes so erratic, and I don't have time for this.
Okay. Well, I mean, I'm not having any symptoms or anything, so I don't know. We might disagree on some of those things, because I feel like that's getting, I don't know. For me, I feel like you're interfering with Mother Nature by doing that, but I get it. Okay. And I'm hearing both sides.
You bring a good point. What do you trust nature 100%?
Yeah. I mean, 100%. That's, I guess that's hard to say, because, but I don't know. Is nature making mistakes? It feels like
how many
nature knows what it's doing.
Do you see cancers every day? I mean,
you're right.
Natural is not perfect. Nature is not perfect.
Okay.
You obviously don't want to go like mess with things. If it ain't broken, don't fix it. But,
right.
But when nature makes a mistake, you intervene. Like, God forbid, if you had breast cancer, would you be like, well, it was nature's way of killing me, let it go?
No, you're right. Yes.
Well, look, and then another thing is, like, 200 years ago, you and I would not even have this conversation, because both of us would be dead, statistically speaking. That's nature for you. So why would you not want to use technology to your advantage?
Okay. I think we differ a little bit on some things, but I'd still love to.
I'm willing to understand what you mean. I mean,
you know what? I just interviewed these people. The episode hasn't aired yet, but they were talking about they did a documentary, and it's on the matriarchy and how women used to lead postmenopausal, and that we medicalize menopause a lot now, whereas people used to go through menopause, and that people weren't dying in the numbers that we think they were because, anyway, so I just had this conversation. So that's still fresh in my mind. And, I don't know. For me, I feel like it's a balance. I do want to treat the things that you're right, that could probably kill me, or that are really bothersome to me. But I don't feel like I need to treat and medicalize every single thing. Maybe that's where I'm coming from.
That's, you may say like, you know what, I'm going to take my clothes to the dry cleaner and let them dry clean my clothes, but I'm going to wash my floors myself. I don't want to hire a maid to do that for me. So like you're picking and choosing what you want to do. That's a personal decision. Of course, you don't have to medicalize everything. I totally respect that. But I have women who can't sleep at night without their hormones. Literally, as some people cruise through it, but I would be sitting in the room talking to a patient and I would break into this cold sweat, like literally visibly dripping sweat. And I would go outside and, my medical assistants are very young and be like, why is it so hot in here? And I literally look at all of them. They're wearing jackets and coats because they're cold. And I'm like embarrassed because I'm like, I don't want to live like that. And I was picking up 3 or 4 times a night to use the restroom because, I would pee 4 times a night. And then I realized when I went on hormone therapy, I was like, oh my God, it wasn't that I had to pee. It's just that I would wake up and I'd go pee because I would wake up. It wasn't because I had to pee, because I would go pee and a little bit of urine would come out. But when I would wake up and with my poor sleep, I would get that sensation of peeing. So, and believe me, everyone's happier since my sleep got better.
Yes. I don't think anybody should suffer needlessly. I also am there. So yes. Okay.
That's why it should never be a cookie cutter decision. Like we should not tell women what to do with their bodies. We should not force hormone therapy. We shouldn't shame them. But if somebody shames me for using hormone therapy, I would have a problem with that. I would be like, especially a man, if they they tell me like, oh yeah, you 200 years ago they didn't use hormones and oh shut up, like don't talk to me.
Right. So you have no right to talk. No, I agree.
So I agree. Personal decision. Every woman should make that decision themselves, and we shouldn't shame anyone. And like you said, you may not want to wash dishes, but you want to wash your floors. That's up to you. You may, want to ride a bicycle and not have a car, but that doesn't mean if you want to travel to China, you want to ride a boat. Every day we wake up in the morning and we make decisions for ourselves. And you just have to but as an expert, my job is to help patients understand their options. Does that make sense? It's not to force anyone to use medications. It's not to force anyone to do a colonoscopy. Here's the statistics. Here's the evidence. And I want you to make the most educated decision you can make,
Yes. I think that's wonderful. And I'm so glad that you came on to talk to us about it. And I really appreciate your knowledge and your passion and all the things. You've given
Lauren.
us a lot to think about, Dr. Angie.
I have to tell
you.
You are brilliant. And this is one of the best interviews I've done because unlike the other vegan interviewees, you're so open-minded. And
thank you. I want to bring the information to the people and let them think about it. I mean, like I said, I'm thinking about it. Am I jumping on a statin today? No. But I've definitely thought about it. And like I said, I'm trying some other things and, I'll let you know. I'll let you know how I end up.
Well, good for you.
Well, thank you very much. I appreciate you.
My pleasure.
Take care.
It was really wonderful talking to you.
You too. Bye-bye.
Bye.
Thanks for listening, friend. From my heart to yours, be well until we meet again.